Well, I am just so delighted to be here with you today. And to everyone who is going to be joining us today, I'm Susan Benigas. I serve as the Chief Executive of the American College of Lifestyle Medicine. It's a role I've been in now for over 11 years, and I've had the opportunity to work with so many amazing presidents. Let's see, David Katz had just become president when I started, followed by Dr. George Guthrie, then Dexter Sherney, then Dr. Kate Collings, then Beth Frades, and now you, Padmaja Patel. And I always marvel at how ACLM has been given the gift of having the right president at the right time. And we're going to get into today about some of the reasons that you really are the right president for this moment in time. And so I think that everybody listening would like to learn more about you, specifically about your journey into the field of medicine. So as you look back, what really sparked your interest in the field of medicine? So like at what age and where were you and what were you doing at the time and what kind of led you into this field to begin with?
Well, thank you, Susan. What an honor it is to be with you for this conversation and to work with you. I'm deeply grateful for this wonderful opportunity to serve our community. So the question about my passion or interest about medicine, actually, I should say medicine was not my first choice. After high school, I had a strong interest in actually pursuing engineering. But, you know, my dad had this long-held dream for one of his children to become a doctor. And so as the youngest in the family, I felt a deep sense of responsibility to really honor his wish. And so I chose to follow the path of medicine just to honor his wish. And I was 18 years old. As you may know, in India, students enter medical school just after high school, just after the 12th grade.
Okay. And then was it residency that brought you to the United States? And where was your residency?
Yeah, so I actually completed my ear, nose, and throat ENT training and certification back in India before I moved to United States. And when I came here, I quickly realized that as a foreign medical graduate, it's difficult to find surgical residency. So I considered changing moving into internal medicine, which was one of the only options I had. But I'm very excited that I pursued that, which is kind of the foundation that really brings you comprehensive knowledge about how to address adults, patients, and then also offers you opportunity to pursue higher education or fellowship training. So yes, internal medicine became was not a primary choice, but became, my preferred choice after coming to United States.
Yeah, and definitely it served you well. And then it was internal medicine, primary care. And what did that path look like? So, kind of share with me what your path in internal medicine primary care was from the time that you finished residency and what kind of brought you to Midland Health and that journey.
Yeah, so I did my first 6 months of internal medicine training at St. Luke's in St. Louis. And after that, I took a transfer to University of Missouri at Columbia, where my husband was actually finishing his fellowship in GI. So I completed my training in Columbia at University of Missouri, and then came to Midland, Texas, just followed my husband, who had started his practice in Midland, Texas. So I began working initially with Midland Health, which is the local health system, as a primary care clinician and internal medicine provider. But within 4 or 5 years of my employment, I had this strong desire to go on my own as I have a private practice. I really wanted to learn this, having the deeper understanding of the business side of the healthcare. But I also felt that in addition to having this independence that will bring me not only the clinical and administrative skills, but also allow me to bring in more person-centered care for my patients.
Mhm. And I know that it's been a few years ago, but something happened while you were at Midland Health that was really kind of a catalyst for a paradigm shift. And so share about what happened and really where you were at the time, and even things that you may have been experiencing that sort of made for fertile ground for that paradigm shift to happen.
Yeah, so I actually, had reached a point in my career where I thought I was just kind of having the sense of, getting tired of doing more of the same, right? I had this very monotonous clinical work, increasing administrative burden, and just I had this increasing feeling of being not fulfilled in my role. And so I was really thinking about maybe, changing career or pursuing maybe business degree or something. And just around that time, a friend of mine actually invited me to an all-day seminar at a local church, which was led by Dr. Scott Stoll. So that, the session was on the power of food as medicine and lifestyle medicine, and the compelling scientific evidence that he presented that day completely changed my personal and professional trajectory, because it was very transformative. And what struck me was that this powerful evidence-based approach to care had yet not sort of trickled into mainstream medical care.
Mhm.
And, it was just very shocking to me that, wow, here you have a powerful way to bring health or restore health. Yet most of us weren't doing that. But then core principles of lifestyle medicine really made sense to me. So I started pursuing attending conferences, to getting CME courses, and then eventually obtaining the board certification in lifestyle medicine. And so, yes, that shift from disease care to bringing more health care, I think all of that happened with, I would say, because of this training and certification.
Yeah. Isn't it amazing that we hear this every day from new members of ACLM? It's like this, whatever that catalyst was for their paradigm shift, because, by and large, this is lifestyle medicine, using food as medicine, exercise, sleep, stress management. These are not things that are part of traditional medical education.
Right.
No doubt that's starting to change, and I like to think that ACLM is, playing a major role in that. And so, after really, learning about lifestyle medicine and all the different pillars of lifestyle medicine, how would you say that really has impacted you personally and your clinical practice?
Yeah. So I would say, as I really learned the science and the data, one thing was very clear, and kind of my aha moment was that, despite being lifelong vegetarians, many of my family members and friends were experiencing very similar chronic disease illnesses and mortality rate, just as you would see within this standard, those who are consuming standard American diet. And so it became very clear to me that just simply being vegetarian was not necessarily being healthy. And so I had to really kind of improve my own diet in terms of, making more whole foods and avoiding a lot of processed and refined products. But when it came to professionally, I started actually introducing lifestyle medicine principles to my patients. And initially, I didn't have a lot of resources. It was more about giving them a prescription of, okay, you will be watching this documentary or check out this website. Here are the books, here are the recipes, or these are the apps, just giving that prescription. And to my surprise, within just a few months, many patients came back with some remarkable results. And I vividly remember one of my patients who was a new patient who came to me, and just like everybody else, I offered same resources to him. And then he came back in 3 months later. I could not even recognize him. He had lost so much weight. He had improved all his chronic conditions, and we started working on taking him off my prescription medication. So that experience is still kind of, something I would say was kind of a turning point for me. It was evidence right there to encourage me to continue to work on this path, and really started thinking like, okay, how do I make this care available to many more patients? How do we scale it and have a bigger impact?
Yes, medication de-escalation, something that, again, not part of traditional medical education,
Training.
but, you experienced it in your practice, and your fellow lifestyle medicine physicians are experiencing that every single day, in
Absolutely.
their practices. And so what, what first led you to the American College of Lifestyle Medicine?
Yeah. So, as I started learning about the evidence, very early on, I started sort of asking myself this question like, yes, this is great. Lifestyle medicine works, but how do I actually bring this into my clinical practice, right? And at that time, there weren't many resources to guide that integration other than ACLM. So, which is what brought me. I became a member, and then clearly, took. I think one course I would really acknowledge here was this lifestyle medicine core competencies course, which was part of a prerequisite for board certification. It really gave me that framework around how do you assess those, lifestyle pillars and lifestyle medicine vital signs, and how do you bring those lifestyle medicine interventions into your clinical practice. So yeah, I think becoming a member really sort of opened many opportunities. Obviously, I could access patient-facing resources, practice advancement tools. There's a big library of webinars that you could access, right? Brings you a lot of information about what members are doing, how innovative care models have been implemented, success stories. And then most importantly, you get to connect with this purpose, passion-driven members of our community. So yeah, I think it's been truly inspiring. And I've made some lifelong friends after joining ACLM. So I would say it's a very powerful community of like-minded people that are
Is
truly transforming healthcare.
It is. It is. As we always say, it's a magnet for purpose, passion-driven medical professionals. You
Mhm.
exemplify that, and and the growth trajectory is remarkable. And I think you're right. It's like for so long we said that our foremost priority was to fill the gaping void of lifestyle medicine, including food as medicine and medical education across that entire continuum, from undergraduate to graduate medical education to continuing medical education, with courses like the Foundations of Lifestyle Medicine course, and the Remission of Type 2 Diabetes, Reversal of Insulin Resistance course, and so many. I feel like and you've played a significant part in this, as have your fellow presidents, of really achieving that. I think we really do have now those foundational building blocks that enable us to manifest ACLM's vision of a nation and world wherein lifestyle medicine is the foundation of health and all healthcare. I think it's interesting too, when it was a couple of years ago that I stepped back. I was like, wow, look at the composition of our board. You as an internal medicine primary care doc, and we have other internal medicine, primary care, family medicine. But, when I looked at like this year's board and the board of last year, cardiologist, endocrinologist, oncologist, physiatrist, psychiatrist, OBGYN, pediatrics. I mean, it really is, even that is sort of a microcosm of our advocacy and understanding that lifestyle medicine root cause treatment is sort of a first line treatment, should be the foundation of
All health.
Everything from
Yes.
gastroenterology to orthopedics, and yeah, so very true. Well, you have been such a force. I think about ACLM's, well, in my tenure over the last 11 years, which is the 11 of ACLM's 21 years at this point. At first it was really focused on membership, and then the conference, and then education, and then we started a corporate roundtable, which is now sort of morphed into an innovators council. But along the way, as we then started our research department, and we just kept building,
Yes.
with, of course, marketing and communications as part of it. But then it took all of these building blocks to get to the point that we could really focus on advocacy, which we started when Dexter Sherney was president. We've been building on since 2019. But then you've been such a driving force in our entry into kind of what all of the rest of this is enabling: practice advancement.
Mm-hmm.
And so with practice advancement, you were, again, that spark that started our clinical practice and quality committee. And so talk a little bit about the driving force for you in establishing that committee, which really, again, sort of is catapulting us into the next level. Because if we're able to crack the code on practice advancement, then, again, it really is a benefit to all clinicians and all patients. So tell us a little bit
Yeah.
about that.
Yeah, so early in my lifestyle medicine journey, it became very clear to me that delivering this transformative approach to health is simply unsustainable in a 15-minute office visit in a fee-for-service payment model. And so I also started serving on some of these national organizations like National Quality Forum, Primary Care Collaborative, and then Partnership for Quality Measurement. And it was very obvious from listening to all the healthcare leaders that everyone is talking about achieving the health goals that our members are actually already delivering them. And so for me, it was like, okay, why is this care not universal? Why is it? So I really committed myself to fully understanding systemic barriers, really raising awareness of lifestyle medicine, and developing innovative, scalable, and financially viable models of care. And really making this value proposition of lifestyle medicine visible to healthcare leaders, policymakers, and payers alike. And I'm really excited. I think what we made significant strides in the last 4 years in really defining what it means to practice lifestyle medicine, not just teach it. And from care model design to policy advocacy, we are really advancing a movement, I would say, especially because of practice advancement department now at ACLM. And then we also from the clinical practice and quality committee. So yeah, it's been powerful, I think, what we've done, and it's really moving the needle in a significant way.
Yeah, no question about it. And we talk about on occasion when we look at our growth trajectory. So, for instance, even ACLM's membership in the fall, going into 2020, we had about 3,500 members, and then 2020 emerged, and we know what that brought: COVID. We had our next two conferences were virtual, and by the time we had our next live conference, we had tripled the membership. Wow. And that growth trajectory, and now, we're up close to 14,000 members. Mm-hmm. But I think that a lot of what fueled this as well was COVID shone such a bright light on the urgent need to address the underlying conditions that exacerbated the virus's most harmful effects. And those underlying conditions were, by and large, lifestyle-related chronic conditions. And so it sort of laid bare what, no one could ignore this any longer. And I think that really helped to fuel awareness about lifestyle medicine and the urgency for it. And so it was this kind of star alignment. I mean, the tragedy of COVID, no question about it, but it certainly has focused attention on the need to treat root causes of disease and to identify and eradicate the root cause with the clinical outcome goal of health restoration, disease reversal and management, not just a lifetime of disease management. And so the timing of all this, I think, has been really has helped to fuel ACLM's growth. And then your focus has been on the clinical practice, certainly fueling the advocacy, because advocacy is part of clinical practice. And you've been so involved, as you said, stepped into a sort of stakeholder thought leadership role within NQF as we dove deeply into understanding quality measures. Yeah. So now we really look at our advocacy priorities in 3 buckets. And so talk a little bit about that, those 3 buckets, and why we're now focusing in those 3 areas in particular.
Yeah, those are 3 buckets, are 3 major priorities, right? There we have a long list of ask, very detailed, but I think 3 main priorities sort of fall into these 3 buckets. One is obviously education, really making sure that we are training and equipping medical students, residents in training, but also train clinicians who are in practice, including health professionals, and entire interdisciplinary team member, which means the entire workforce in lifestyle medicine, making sure they're treating, identifying, and eradicating the root causes of disease. And then we have second bucket, which is the payment models. That's really, we're asking either developing new models of payment or modify existing models that reward patient outcomes, improved outcomes, and also asking for not just disease management, but have incentives for health restoration or disease remission or reversal. New models, hopefully, that can also cover payment for entire interdisciplinary team members. Right now, that is a big challenge to integrate healthcare extended interdisciplinary team members. We also want CMMI to design a lifestyle medicine demonstration project, integrating some of our existing care models. And especially in value-based care model, we are hoping that they will also work towards removing unintended consequences of current disease management framework that they have. So current framework, which really focuses, how we deliver care, how we incentivize care, and how we measure care, is simply on chronic disease management framework. And we really are asking for a paradigm shift here. We're talking chronic disease remission and health restoration. And when it comes to the third bucket, we're talking about quality measures, developing new quality measures that reward rather than penalize clinicians for improving health outcomes, which we've seen our clinicians who put chronic disease into remission often get penalized financially. And then developing new quality measures that would reward and incent sort of foundational lifestyle medicine care, which is what's recommended in clinical practice guidelines of many chronic conditions. So we're also asking CMS CCSQ team, which is the quality measure team, to assess and address LM interventions. So develop new quality measure that would allow clinicians to address lifestyle medicine behaviors as part of their everyday care. So these are the 3 buckets we're hoping that the CMS and CMMI will focus on.
Yes, absolutely. And it's taken us a while to get to this point. It's taken us a while to really identify what those barriers are. I know when we first started talking about quality measures a few years ago, it I finally, it was like I realized these are the rules of the healthcare game. And
Yes.
as they are now, they don't really allow our lifestyle medicine trained physicians and medical professionals to score, let alone win. And
Yes.
that needs to change rather than just rewarding process. I know one of our docs talked about having a patient with hyperlipidemia, and
Hmm.
he prescribed therapeutic lifestyle intervention. And that patient achieved incredible outcomes, weight loss, dramatic lowering of cholesterol, and yet he was dinged in the Medicare 5-star rating because he had not prescribed the statin, because it was all based on process, not on outcome. And
Yes.
these things need to change. And so appreciate the real trailblazing work that you're doing in these areas. And I know that several proposed models have been submitted. ACLM has submitted to
Yes.
CMMI. One even on something we're calling the Diabetes Remission Project, and
Yes.
which is a very important one, and I think really leverages the whole suite of assets that ACLM has, from the guidance documents, the expert
Hmm.
consensus statement, to the new clinical practice guidelines,
Guidelines. Yes.
the leader curriculum, lifestyle
Hmm.
empowerment approach to diabetes remission, which really, that focuses on shared medical appointments. Talk a little bit more about the importance of shared medical appointments and how they fill such an important need in our healthcare ecosystem.
Yeah, so shared medical appointments have been around for 30 plus years. It's an evidence-based approach to treat chronic conditions. But what lifestyle medicine clinicians have done is really brought interdisciplinary team members into these group visits. So clinicians have the opportunity to meet 10 to 12 patients simultaneously in a group visit, and also integrate interdisciplinary team members at the same time and help patients into not only education, goal setting, but also providing that ongoing support during those team visits. Now, we have seen our members have integrated variety of disease or condition specific shared medical appointments. We call it lifestyle medicine shared medical appointments, LMSMA. What I find is that this is really a clinical framework that allows us to bring elements of whole person approach to care. And so this is a very successful model addressing chronic disease burden. When we use it intensively, when we add intensive dose of lifestyle medicine, we also often put chronic disease into remission through the same group visit framework. So I personally think it's a fantastic care model supported by evidence, clearly demonstrate the efficacy of whole person approach to care. And we've seen tremendous outcomes. We proposed these models to CMMI, and I think one of the model, which is Diabetes Remission Project, again, uses a very similar model. And it's kind of a turnkey solution from ACLM, which anyone who's interested should really reach out to us to offer that option, because it's a right away you could integrate in your clinical practice and transform all your patient outcomes right away.
Yes, yes, absolutely. And I think that in so many of these resources that we offer are open source,
Yes.
and some open source for everyone, many open source for ACLM members. So we've really tried to, again, create these, as you said, turnkey clinical practice integration and remove the barriers to entry.
Mm-hmm.
And in the, I know that whether delivered in person or even
Virtually.
virtually, these have been proven to be so effective, and even
Absolutely.
creating that, the social connection of the shared medical appointment is so reinforcing to the behavior change. I mean, we have patients that go through these programs and they want to come back. They're like, can I be part of the next cohort? I mean, it is remarkable. And I think while the paradigm of one clinician, one patient, one treatment room will have its place, but it certainly is not designed to really meet the needs of treating and reversing the epidemic of chronic disease that we already have. And so appreciate you
Yeah.
being such a champion, for this.
Yeah, and also the shortage of primary care clinicians and burnout. I think shared medical appointment really improves access to care. That's another big sort of a solution that we need to think about. How do we provide this solution? And as you said, it's also very effective virtually. So that provides that scalable model for delivery as well.
Yes, yes. And, Dr. Dean Ornish, who is, one of the foremost researchers in our field, he has his unifying theory where he often talks about that lifestyle medicine treatment is, whether for heart disease or type 2 diabetes. He's now in his most recent research around Alzheimer's. But it's really, no matter what the chronic condition, it's really these pillars of lifestyle medicine that are efficacious for all. And that is exciting to know that. Yet we're really focusing on type 2 diabetes. And I know we're talking about the looming global pandemic of type 2 diabetes long before any of us had heard of COVID-19. And so the clinical practice guidelines that just debuted,
Yes.
that is an amazing sort of kind of centerpiece of our effort in that regard. So, Padmaja, if as you encounter other clinicians that may just be hearing about lifestyle medicine, what's your message to them, to your fellow physicians and medical professionals across this country about why lifestyle medicine training they should look into it for themselves personally and for the benefit of their patients?
Well, I would say, well, first of all, this is the future of healthcare, right? So lifestyle medicine is the future of healthcare. It really offers this science-based, patient-centered approach to care that not only treats the root causes, but really empowers patients on their health behavior journey. So I think all of us went to medical school to really deliver the kind of outcomes in which only lifestyle medicine actually brings them. So it's the training and board certification in lifestyle medicine really provides that practical framework of bringing that evidence-based tools into your clinical setting, and you can start really implementing in your practice. And what I would say is that it's not necessarily replacing what you have been doing. It would enhance the clinical practice or foundational education that you've had. So this is more about really enhancing your skills in behavior change, patient engagement. Really, how do you work with interdisciplinary team members, which is really a unique way to bring into whole person approach to care. So I think these are really the benefits of bringing into your clinical practice and really connects you with connection with the members of our passionate, purpose-driven community members of ACLM. So truly, I think the reason you want to get certified or trained is to bring about this transformative care to your patients, but also enjoy the professional satisfaction that you get by delivering this high-value care in your clinical care models.
Yes, yes. It definitely reignites the passion for why so many went into medicine to become true healers. And I think that You're so spot on. And when we look at the growth, I mean, now 120 members of our Health Systems Council, lifestyle medicine interest groups on nearly 200 campuses across the country. I think the lifestyle medicine residency curriculum now available in about 380 programs across the country, about half of which are family medicine. So there's definitely momentum, and yet we know that the best is yet to come. While so many people have been reached with this message of, I like to think of lifestyle medicine, it's like hope. It really is healing. It is health. It's health restoring. It's what our nation needs now more than ever before. So in the seat that you sit now as president of ACLM, already having accomplished so much in your first 6 months of your 2-year term, as you look ahead, what do you hope to accomplish over the next year and a half of your term? And what are you really most hopeful about as you look ahead as well?
Yeah, well, that's a great question. I'm committed to building on this incredible foundation laid over the last 20 years, what we call as essential building blocks. The vision and most recently, the powerful momentum that we have experienced. I think I'll continue to build on that. My goal is to continue advancing our advocacy efforts on those 3 buckets that we talked about, the 3 priority areas, really making sure educating the entire healthcare workforce in lifestyle medicine, ensuring clinicians are equipped to address the root causes of chronic diseases, and then developing and scaling better payment models to support interdisciplinary care integration in team-based whole person approach to care. And then not just managing chronic disease, but really restoring health and achieving remission of these chronic conditions. And then continue to work with, agencies like CMS and CMMI on this innovative quality measures that we want them to develop, which would hopefully assess and prioritize lifestyle behaviors. If you're not measuring, you can't address. And I think this is the key missing part of their quality measurement portfolio, is to really develop a lifestyle medicine quality measure. And then really work around misaligned quality measures as well to make sure that our clinicians are not getting penalized for health restoration, for improving the health of their community and patient population. So I would say there's a clear path forward, is to really work with all these entities, as we just said, having Innovators Council members, which are health plans, ACOs, employers, health systems, and then work with agencies like CMS, CMMI, quality measure team, and then many stakeholders that we regularly engage with, really focus on this value around prevention, health restoration, and then improving overall well-being of people. What makes me more hopeful, I would say, is this incredible momentum that we have seen, right? I think what's exciting is to see that not only the time is right, but it's this convergence, right? Public awareness, there's scientific evidence, and there is this opportunity to influence even policy, which I think we never saw that before. So these are very unique time. And we say this, that lifestyle medicine is at an inflection point, right? Because of this convergence. And I think it's a very exciting time. We know that chronic diseases cost 90% of healthcare spending. And yet we know that 80% of these conditions are preventable by addressing modifiable lifestyle behaviors. So what I believe felt like a fringe idea at some point, perhaps lifestyle medicine is really now being increasingly accepted across medical schools, health systems, and public health agencies. And we are really seeing this sort of major shift. More clinicians are pursuing board certifications. We think we also know more institutions are embedding lifestyle medicine-based care. We recognize that the payers are finally appreciating the value of prevention and chronic disease reversal. And then obviously even these federal agencies like CMS are beginning to integrate lifestyle medicine into their new strategies. And let's not forget, even MAHA report had lifestyle medicine mentioned in it. So clearly, we are making significant progress, I would say, in every area. As you just mentioned, clinical practice guidelines, which is something, first groundbreaking CPG that we released on lifestyle interventions for treatment and remission of type 2 diabetes and prediabetes in adults. And we made an announcement on EPIC integration of lifestyle medicine assessment and diet screener earlier this month. We published a joint GLP-1 advisory advocacy, ongoing advocacy work with AMA, CMS, CMMI, and CMS CCSQ that we continue to expand. And then most importantly, we're also growing our community as membership number continue to grow. So I'm really hopeful that we're moving beyond what we thought we were doing awareness to more action now.
Yes.
And we're no longer just talking about food as medicine, behavior change, or team-based care. We're building systems, we're training healthcare workforce, and we're re-influencing policy to make it a norm. And I'm also taking this personally and getting back into clinical role as the Chief Medical Officer of Nudge Health. And this is really, again, to prove that the value proposition of lifestyle medicine across different care settings and different payment models. So this is, I really see this as once in a generational opportunity for the field to redefine what good healthcare looks like. And I think we have this unique opportunity. Finally, as you say, stars are aligned. And I think we have this unique opportunity to really bring health in the center of healthcare.
Yes, so beautifully stated, so beautifully stated. And you're exactly right. And when we reflect back, it was 21 years ago that John Kelly, our founding president, and a small group of founding physicians came together. And by the time ACLM was first established, they had recruited 100 founding members. But they saw at the time, they were alarmed by the trajectory of chronic disease and the associated costs, knowing that they were lifestyle related by and large. And they saw that there was no other field of medicine that represented evidence-based therapeutic lifestyle intervention to treat and even reverse already existing disease, knowing that if the dose was efficacious for treatment and remission, prevention was the natural byproduct. And so, I marvel at how over the first 10 years, by and large, volunteer physician led, and then the momentum, really building on the shoulders of all those who have come before, and to be at this place now where we know that the current status quo is unsustainable. It is not in the best interest of you or your fellow clinicians and physicians and medical professionals or patients. And so the winds of change are definitely blowing, and you and your fellow ACLM leaders have been a huge part of that over the years. And so I think we all are extremely hopeful about hearing for the first time just over the last couple of years on Capitol Hill, they're talking about diet-related chronic disease. As you said, in the most recent MAHA Commission report, talking about root cause treatment and lifestyle medicine, we like to think that, we've had some influence on some of these things over the years and are hopeful that ACLM can insert its voice. And that's what we're doing on behalf of our members. We're doing on all of their behalf what individually they really cannot do on their own. And so I just want to say to you, Dr. Padmaja Patel, on behalf of our nearly 14,000 members, on behalf of our member interest groups and their leaders, Some of those interest groups have 1,000 members, so over 30 member interest groups, our committees, our task forces, of course, our staff, 45 members strong, spread out across 21 states. We'd like to say we were virtual before virtual was cool. And we just so appreciate your leadership, your fellow board members. And, it's such a gift. I always say about you and your fellow board members, you give us the gift of your time. And there's no greater gift in your passion and your dedication, your fearlessness, knowing that really for such a time as this, that we have got to infuse health back into healthcare. And we know that it's lifestyle medicine that does that by really identifying and eradicating the root cause of disease. It really empowers patients to take far greater control of their health destinies. Of course, understanding social drivers of health, but addressing that in how you're trained and what you do. And so I agree with you. I think that it's like we're coming into the bend of the hockey stick. It's really incredible to see that we really have an opportunity that ACLM does to help educate, equip, and empower your fellow medical professionals across this country and those that they serve, to reverse our trends and to put our nation on a path of health. As our former President David Katz would often say, adding years to life and life to years. And that is the goal. So thank you so much for your time today. And to all who are watching, if you're not yet a member of the American College of Lifestyle Medicine, now is the time to join, become part of this galvanized force for change. And as Dr. Patel talked about throughout this chat that we've just had, if you aren't yet certified in the field of lifestyle medicine, please consider becoming certified. And you have until the end of September 30th, to register for certification through the American Board of Lifestyle Medicine. You can learn more about that on our website as well at lifestylemedicine.org. And be sure to join us for Lifestyle Medicine 2025, the annual conference of the American College of Lifestyle Medicine, which is set this year for November 16th through 19th at the Gaylord Texan in Dallas-Fort Worth and Grapevine, Texas, specifically. I have an incredible lineup of keynote presentations, concurrent sessions, a sold-out exhibitor floor. I think 238 research posters will be on Research Row. Blue Zones is our exclusive community health sponsor for the conference, and many other organizations that are part of it. It's going to be an amazing event. We sell out every year, and certainly are on track to do so again this year. And then we'll have a vast virtual audience as well, with all of those CME credits then meeting the live prerequisite to sit for the ACLM exam. So Dr. Patel, I'm grateful for you, and thank you for your time today.
Thank you, Susan. What an honor it is to really work with you, with someone who leads with so much passion and integrity. And thank you for this conversation today. I appreciate that. Thank you.